Hello and welcome to our virtual symposium, Lupus Fatigue, Causes, Treatment, and Managing Expectations. I'm Dr. Lindsay Springer, a licensed physical therapist, a partner with Kaleidoscope Fighting Lupus, and your MC for today's symposium. Today you'll be hearing from me as well as from two experts on lupus fatigue, Dr. Sharon Dowell and Arnita Roberts-Christie. Dr. Dowell is a practicing rheumatologist at Howard University Hospital, and today she will be describing the possible causes, symptoms, and treatment for lupus fatigue. Arnita Roberts-Christie is a registered nurse and patient engagement liaison with GlaxoSmithKline. She is a passionate champion for those with lupus and will share ways to help deal with lupus fatigue in particular, as well as other aspects of living with lupus. We'd also like to take this opportunity to thank our presenting sponsor, GSK, for making this event possible. Now, let's hear from Dr. Sharon Dowell.
Thank you, Lindsay, for that great introduction. I am delighted to be here again today to talk about fatigue. And that is because it is one of those questions that often comes up in the visit with a patient. A lot of people actually have problems with fatigue. In fact, it's one of the most disabling features of lupus and can affect up to 80 to 100% of patients according to some studies. And it's interesting because fatigue is not solely linked to lupus activity. What do I mean by that? Well, you may know that in lupus, the immune system is activated without a cause. So think about when you have a cold, your immune system gets revved up or activated to treat the virus that's causing the cold. And when it's revved up, you may feel unwell. So you may have aches and pains, fevers, shakes or rigors, and tiredness or fatigue. You may feel exhausted because you're fighting that infection. Well, in lupus, your disordered immune system is not fighting the infection, it's fighting your body, and you also can feel unwell. And so fatigue can occur when you have very active lupus. But what is interesting is that even patients whose symptoms are controlled with medication or who only have mild lupus activity still feel fatigued. And that's why we have to talk about it. Now, before I get ahead of myself, it is important for you to know that there are several other conditions that can manifest with fatigue. So you really need to talk to your doctor about it. Some of these conditions can be linked to lupus, like a low blood count or anemia, which can cause you to feel tired when you're doing things. Kidney failure, which can be as a result of lupus inflammation in the kidneys, or even having a heart condition. That can all cause you to feel tired and fatigued. And then there are other conditions not quite related to lupus, which can cause the same symptoms. So if you have a thyroid problem, or if you have depression, you may also have fatigue. So the first thing to do is to talk to your doctor about your symptoms. They can talk to you, take what we call a history, which is just gathering all the information that you have, do a physical examination, and do some blood tests to make sure that they evaluate you for any of the other conditions which can manifest with this exhaustion and fatigue. However, many patients who have lupus have persistent and severe fatigue despite going through this extensive evaluation and despite going on therapy for their lupus. And given that lupus can affect anywhere from 20 to 150 per 100,000 persons, in other words, a lot of people, it can be devastating for the community at large, in addition to you, the person who has lupus, because it can affect the way you work, the way you go to school, it can affect your productivity and your personal relationships. So it's something that we definitely have to address. Now, currently in lupus, we really have no clear way of determining the underlying cause of fatigue. And that's given that we've already done that full evaluation looking for other known causes. We in clinic would do a quick survey to really try to see how severe your fatigue is. In my clinic, we just ask patients on a scale of 1 to 10, 1 being no fatigue and 10 being severe fatigue, where are you on that scale? In other places, they may actually have you fill out a questionnaire that is validated to quantify the severity of your fatigue. I think those scales are usually done most often in clinical research when they're trying to see whether an intervention makes a difference for how a patient feels. But the range of 1 to 10 is a way for you to assess how you vary from day to day as well. Generally, we think that the most likely cause of fatigue is that it's really multifactorial. What does that mean? That there are many different things that are contributing to how you feel. It is associated, we know, with physical activity, obesity, sleep quality, depression, anxiety, cognitive dysfunction, and vitamin D deficiency and insufficiency. And also, there are other conditions like fibromyalgia or other medical problems that can also lead to fatigue. So all of these things on their own or together can really affect how you feel. For the purpose of this conversation, we will focus on the effects of fatigue with relationship to exercise, healthy eating, sleep, and your mood. Now, fatigue is associated with a decreased functional status and decreased exercise. We all know how important exercise is for our heart or cardiovascular health, for our physical well-being, for our mental health, for just overall sense of how well we feel. It is also important to maintain strong bones, especially in SLE, where some of your medications like the corticosteroids can lead to thinning of your bones earlier in life. And we call that low bone density. So in some studies looking at exercise in patients who had SLE, it was found that lupus patients had more fatigue, decreased exercise tolerance, and a poor perception of their quality of life compared to those who did not have lupus at baseline. The patients were then put through a supervised exercise program, and at the end of it, it was found that these features all improved. So after exercise, there was actually an improvement in the sense of fatigue, in their exercise tolerance, and in how they felt about their life in general. One of the interesting things about this study is that it showed that even patients who had mild disease activity, or in other words, their lupus was actually relatively well controlled, even those patients had severe limitations in their exercise tolerance. So we are just sort of stressing that this sort of fatigue and exercise tolerance does not really depend on how active their lupus was. And they found that there was a correlation between this low exercise tolerance and their physical function as measured on questionnaires during the clinical trial or during the research study. So once again, it's just pointing out that the fatigue and the exercise tolerance were really not dependent on lupus activity. And that can be really frustrating to know that even when you're doing everything you can, you're taking the medications as advised, that it may not have an impact on your fatigue. But what you can take away from this is that exercise may actually be helpful. We know that more research is needed in this area, but I myself generally recommend to my patients that they should engage in some form of regular physical exercise. And if you're someone who hasn't been doing this, then of course you would start out in a very sort of slow and controlled fashion. And as you build tolerance, then you can increase your activity levels. But overall, we know that exercise is good for your heart, it's good for your mental health, and good for your overall physical well-being, and will likely also help with lupus fatigue. As we talk about exercise, it is important then to talk about obesity. Now, it is estimated that about 28 to 50% of patients who have lupus may be obese. And this again could be due to several factors. You have decreased activity levels, and then of course some medications like prednisone can also affect weight gain. Now, data from one registry show that there was an association between obesity and fatigue and depression, and that obesity in itself, we know, can be associated with higher levels of inflammation as well. What is good about this is that obesity is actually something that you can change. It's what we call a modifiable risk factor. So working on weight loss can also be helpful in managing fatigue as well. And therefore, careful attention to your diet is also helpful. We all know that our diet can have an impact on our weight, and so we should pay attention to healthy eating. In one study, they compared diets, the low glycemic index diet versus caloric restriction. And the point here is not about the diet that they use, but in the end, all patients lost weight and all patients had an improvement in their fatigue. So eating a diet that is healthy and that can maintain your ideal weight can also be good for your sense of fatigue as well. We recommend eating a diet that's rich in fruit and vegetables and avoiding alcohol or caffeine, which can also affect the way you sleep, and we'll talk about that a little bit later. These are all important interventions that you have control over to maximize your energy levels. So you just have to be thoughtful and deliberate about what you eat. And while on the topic of what you eat, I would like to address vitamin D supplementation. In some small studies, vitamin D deficiency has been associated with fatigue. Patients with SLE are at an increased risk of vitamin D deficiency. As you know, part of our advice is to avoid sunlight, and that actually helps with your vitamin D levels. So I also advise my patients that they should supplement their diet with vitamin D, and this may also help with their fatigue. Many patients who have lupus have poor quality sleep, and it seems clear that if you don't sleep well, then you will feel tired during the day. So it can lead to fatigue, and it can also affect the way that you live your life. Now, there are several factors that may lead to poor sleep. For instance, our diet, what we're eating. Are you taking drinks that are caffeinated close to bedtime? Our medications, what we take, like prednisone or corticosteroids, which are commonly used in lupus that can disturb your usual sleeping pattern. And then what are your nocturnal habits around sleep? Are you in bed at night watching television, or are you on your phone where that bright glare can affect you? And then of course the things like depression, anxiety, joint pain, all of these things can actually have an impact on how well you sleep. And we have shown that the percentage of patients who have fatigue and have poor sleep is more than 50%. So we know that there is definitely an association. Interestingly, sleep itself as well, or having quality sleep, can also impact the immune system. Now, there are some studies out there that are showing there's a clear link between sleep and the immune system. And it has been demonstrated that the cells that cause inflammation and the inflammation chemicals can actually be higher in sleep-deprived patients. So there's a lot more research needed in this area, but sleep is really important not only for your immune health, but also for this sense of fatigue as well. And then we also have to address depression and anxiety, which have also been linked to fatigue. Now, patients who have lupus, they estimate that about 28% will have depression and about 24% will have anxiety. It's hard to know which comes first in this cycle. I mean, some people feel depressed because they feel tired and they can't be as active as they want to be. And sometimes because you feel depressed, you don't feel like doing things. But the point is that we know that there is an association and that it needs to be addressed. Depression and anxiety can also affect your sleep, and that also then leads to more fatigue. So it's a complex issue with several intertwining elements, and we know that increasing your activity levels can help with your depression and then therefore also help with fatigue as well. Pain has also been associated with fatigue. When researchers look at the role of pain, they noted that it has some effect, and this effect is actually independent of other psychological, social, and medical factors. Pain in itself can be associated with fatigue as well, and it's important, therefore, to have good management for your pain. And I'll just briefly mention another condition which we often find occurring with pain and fatigue, and that's fibromyalgia. I'm sure some of you may have heard about it before, but it's a condition where you have increased pain levels all over your body without any sort of obvious signs of arthritis or inflammation in your joints or your muscles. If you're feeling that sort of diffuse pain all over that's been really hard to control, make sure you talk to your doctor about it, because you may be someone who has fibromyalgia. In addition to paying attention to your exercise, monitoring your sleep habits to improve them where you can, actively addressing any feelings of depression and anxiety, there are a few studies that looked at other interventions. And it's sort of hard to extrapolate to everyone who has lupus from some of these interventions, but I just want to mention a couple of them so that you're aware of them. One of them is this sort of psychoeducational intervention. I guess we would call it like a cognitive behavioral therapy, where you have some counseling around things that you can do differently or behaviors that you can change to help with your fatigue. And they found that this actually helped in a small group of patients who had lupus. The other one is acupuncture. Some studies actually show that acupuncture has been found to be helpful with dealing with the fatigue of lupus, and it's something that you can try. And of course, we've harped on this so many times, but a good or regular exercise program can also help with dealing with fatigue. As most of these interventions require a change in habits, it is important to have a support group around you that can bolster you on this journey. And, luckily, Kaleidoscope Fighting Lupus has been there for you. And I really want to thank them for inviting me to give this presentation here today. I really hope it has been a learning experience for you. I know that I really enjoyed doing it. Thank you.
Thank you, Dr. Dowell. As a licensed doctor of physical therapy and someone living with lupus, I appreciate your recommendation to participate in regular physical activity and scheduled exercise in order to reduce fatigue. This is an area of particular interest to me, both personally and professionally. So before we hear from Arnita Roberts-Christie, I would like to expand upon Dr. Dowell's presentation on lupus fatigue as it relates to pain, inflammation, and exercise. There is not yet a clear consensus on a definition for lupus fatigue, but one well-cited study has defined fatigue as being an abnormal, extreme, whole-body tiredness that is out of proportion to the level of activity or exertion. This means that you are beyond tired, but not because you have done anything strenuous. As Dr. Dowell mentioned, fatigue is multifactorial, or in other words, there's many different things that contribute to causing fatigue. But I find it interesting that for people living with SLE, studies show a significant positive association between the level of fatigue and self-reported pain. This means that when your pain level is high, so is the level of fatigue experienced. But why is this? Well, pain is perceived in the brain. When a high volume of pain signals are being sent to your brain, and often from multiple areas of your body for someone living with SLE, your brain is using a lot of its capacity just to manage that pain information. Therefore, when brain capacity and attentional resources are being used to monitor and manage pain, there's less energy available for the brain and body to utilize for other functional needs, such as taking a shower. But wait. There is some good news here. Dr. Dowell did an excellent job of discussing the ways in which you can reduce fatigue, with exercise being one of them. And that is what I would like to focus on for the next few minutes. Exercise can reduce fatigue by directly affecting factors that contribute to fatigue, two of which are inflammation and pain. Essentially, higher levels of inflammation equals more pain. And if you have more pain, you're likely to move less. Less movement equals higher levels of inflammation. This is a vicious cycle that can only be broken with activity. There was a study that showed a 6-mile run stimulates an endorphin release equal to that of 10 milligrams of morphine. This demonstrates that exercise alone is one of the most powerful pain modulation therapies that we have, and it's most definitely the safest and easiest one to access. So, I want you to think about this. You don't exercise because you feel good, though you can. You exercise to help yourself feel better. How does exercise reduce inflammation? It reduces it by regulating some of the chemicals involved in the inflammatory process, such as cytokines, which some of you may have heard about. We all know that corticosteroid medications cause weight gain in the form of excess adipose or fat tissue. This fat tissue actually increases systemic inflammation in the body. So another benefit of exercise is reducing this weight gain, and that means less inflammation. Exercise also improves joint, muscle, tendon, and bone health by providing hydration to tissues. It increases lymphatic drainage and blood flow, all of which encourage your body to break down old cells and replace them with new, healthier cells. And finally, exercise boosts mental health by increasing production of feel-good neurotransmitters, like endorphins, dopamine, and serotonin. These can make it easier to cope with the stresses of life and potentially improve your mood, energy, and self-esteem. And that also helps you move more, further reducing inflammation. With exercise, we can, in effect, create a virtuous cycle. More movement equals less inflammation. Less inflammation means you're in less pain. If you have less pain, you will move more. So, what's the next step? Well, I would recommend you find a physical therapist to help you safely move more. Why physical therapy? Well, doctors of physical therapy are highly skilled musculoskeletal experts trained in examination, diagnosis, and treatment for conditions affecting muscles, bones, joints, and other tissues, including autoimmune-related pain and secondary deconditioning. We specialize in understanding how the body moves, utilizes energy, and is affected by intrinsic factors, such as medications or the quality of your sleep, and extrinsic factors, such as work or personal stressors. Over the course of working with a physical therapist, that deep understanding we have of the body is translated into a personalized exercise prescription to optimize your individual body's function and movement. We work with you to establish an individualized exercise program that is gradually progressed according to your goals and your tolerance. I wanted to take a moment to share a few specific techniques that physical therapists often use for lupus fatigue. One is called graded exposure. Research shows that using graded exposure to cardiovascular exercise is more effective than relaxation techniques alone at decreasing fatigue levels in SLE. And this is likely due to all of the benefits of exercise that we just discussed earlier. Aerobic activity reduces inflammation, which reduces pain, which frees up mental and physical capacity for other things. So let me give you an example of what this graded exposure technique means. It could be that you start with 5 to 10 minutes of walking, swimming, or cycling at about 60% of your max heart rate. This equates to a moderate level of intensity. And then that exposure or amount of activity is graded over time, meaning that as your tolerance to those initial 5 to 10 minutes improves, and you're able to do that on multiple days during the week without feeling a flare, that amount of time is gradually increased by about 10% or so. And then each week, that's monitored by your physical therapist to make sure you're safely able to increase that amount of activity over time. With the eventual goal, meaning that you'll get to about 30 to 60 minutes of aerobic activity at that moderate level intensity per week on 5 to 7 days. You can also apply the same principle to strength training, where you can increase the amount of weight that you're exposing your body to get stronger gradually over time. Another technique is called energy conservation. And I'm not talking about changing your light bulbs. This is rather a technique where a physical therapist helps you identify times during the day or groups of activities that you can put together to best use your energy earlier rather than later and make it through your entire day doing all of the things that you need to do. Additionally, physical therapists are really talented and skilled at being able to find the best ways to protect your joints from potential damage as you're exercising. Remember, you don't exercise because you feel good, though you can. You exercise to help yourself feel better. Now you might be wondering, well, what's the best exercise for your body? It's the exercise that you will do every day. And maybe that means standing up and pacing around for 5 minutes every hour, or on a good day, going for a 30-minute walk in your neighborhood. It's anything that gets you up and moving to increase oxygen intake and blood flow, reduce inflammation, and boost the positive neurotransmitters in the brain. All of that will serve to reduce fatigue and increase your energy. I hope you found this information on fatigue, pain, and inflammation and exercise helpful. If you are interested in working with a physical therapist, you can ask your medical provider for a referral. Or in many places, you can reach out directly to a physical therapy clinic to schedule. If possible, I would recommend selecting a physical therapist who specializes in working with people with persistent pain and/or autoimmune conditions. Now, let's welcome Arnita Roberts-Christie, who will be providing even more resources to help you with fatigue.
Thank you so much, Lindsay, for the introduction. I really appreciate it. And I want to thank both Greg and Tori from Kaleidoscope Fighting Lupus for this opportunity to share information with you regarding practicing disease self-management, managing your lupus, brought to you by GlaxoSmithKline's Us in Lupus program. My name is Arnita Roberts-Christie, and I am one of the patient engagement liaisons here with GSK. What we love to do is to share information about the disease of lupus. And that's what we'll be doing today. I will be sharing information with you, and I hope that by the end of this presentation, you've been able to take something away with you, something that you're going to incorporate into your daily life, something that you as a caregiver will incorporate into your daily life, something that will help you live your best lupus life. Before we continue, please note that this presentation is not to take the place of you having a very open and frank conversation with your healthcare provider. Although I am a registered nurse and have been for a long time, this information is for informational purposes only. It again is not to take the place of you having a very open conversation with your healthcare provider. So let's get started. Us in Lupus, managing lupus, practicing self-management. What we're going to cover today is we're going to talk about lupus education, the importance of it, and I am so proud of all of you for taking time to educate, to provide more knowledge. Knowledge is power, and what you're doing is becoming more powerful today by being here. We'll talk about treatment goals as well as the importance of symptom tracking, which also includes journaling. I said to a group the other day, is journal your journey. And so today we'll talk about what's it like to journal your lupus journey. We'll talk about the importance of communication and then adherence, or sticking to your treatment plan, and why that is so very important. Your role as a patient, as a caregiver, as a family member is critical in healthcare. Being an engaged patient. Well, what does an engaged patient mean? That means someone who is sitting here today. You are taking the opportunity to learn more about lupus for yourself and or for your family member. You're learning how you can create better health outcomes in conjunction with your healthcare provider. Actively managing your symptoms, you and your healthcare team together could help reduce the risk of severe flares and long-term organ damage. But the key to that particular statement is together, you and your healthcare team. So let's talk about what is an engaged patient. On the slide before you, you'll see 4 different pictures. First is a book, and we're talking about educating yourself. Education, as we said before, knowledge is power, and so you can become a more powerful lupus warrior when you have more education about your disease and how to manage your lifestyle. Monitor and tracking your symptoms are so important, and we're going to go into a little bit more detail about that. Communication, also important. Making sure that you're able to communicate, to talk, to share how you are feeling. How is lupus impacting your life? And taking ownership. You're doing that just by being here. You are taking ownership of your health care. So let's talk about education. Let's understand the basics of lupus. Now, you may be living with lupus for a long time, or you may be new to lupus. But let's talk about, well, what is lupus? We know that lupus is an autoimmune disease. It's where your body's own immune system attacks its own healthy cells. It no longer recognizes the healthy cells. When that attack occurs, you develop antibodies to prevent the attacks. But when that occurs, that attack or that area can lodge itself in any part of your body. Whether it lodges itself in the brain, in the heart, in different systems like the cardiovascular system or the nephrology system, you will develop symptoms, and those symptoms are related to inflammation. Let's say you accidentally cut yourself and then it gets infected, right? And so that little cut then becomes reddened. It becomes painful to touch. It can even become swollen. Well, that's what happens when lupus attacks your own healthy cells. It develops inflammation, and sometimes you can see this inflammation on the outside of your body, but oftentimes it's occurring on the inside of your body. So there can be pain, there can be inflammation, and there can be redness. And that's what damage can do to the inside of your body as well as to the outside. And we'll talk about that a little bit more as we go on. A chronic illness is an illness that lasts for more than 3 months. And so therefore lupus is considered a chronic illness. There are signs and symptoms of lupus that last for longer than 3 months, and what we call wax and wane. Sometimes they wake up like a roaring lion, and sometimes they go to sleep like a peaceful cub. Unfortunately, there is no cure for lupus, but what we do know is that lupus can be managed. These flares, these periods of remission, these periods where the lion wakes up or the cub goes to sleep. These are times that we can manage. And how do we manage it? By working together with your healthcare provider and living your best lupus life. Lupus can affect many parts of the body. On the slide in front of you, you see various areas, starting with your brain, your eyes, your mouth, your nose. You can develop sores inside your mouth or your nose. You can develop dry eyes or even small bumps inside your eyes. You can develop a rash on your skin, and that's part of your integumentary system. That rash can be part of what we call a butterfly rash. And if you take your fingers and go like this, and you're creating a butterfly on your face, and that's where that rash will go. Or that rash can go to various other parts of your body. Your heart, your lungs, your kidneys, these are your internal organs, and lupus can affect those, and what we can term organ damage. It can damage those certain parts of your organs. When you see inflammation in your muscles, your joints, that's where you can visibly look at the joints in between your fingers and possibly see that they're red, or they can even be swollen. But these are parts of your body that are on the outside that we can visibly see with our eyes. There are invisible symptoms of lupus as well. Sometimes you can see where lupus is visible on the outside of your body. You can stand on the scale and see that the pounds have gone up from where they were just even a day ago. You can comb your hair and you can look in the comb and see, that's a little bit more hair than I lost last week. Or you can look at the hairline and see that, I see a little bald spot. Or perhaps you have someone in your home that's a little bit taller than you, and they can see on the top of your head that there are bald spots developing. We talked a little bit about the swelling of the joints, rashes on the face, and then sores that can occur in the mouth or the nose. Invisible signs of lupus happen on the inside of your body. This particular picture here, I would say that it's showing someone who may be exhibiting or feeling symptoms on the inside of their body, and they could also be showing symptoms of fatigue. I want to stop here for a moment and talk a little bit more in detail about fatigue. Some of the things that I share with my patients is to make sure that you know your fatigue is your fatigue. Fatigue is a very real symptom of lupus. Your fatigue may be different from the person next to you or the person that you met a couple days ago who was diagnosed with lupus. But the important thing to understand about your fatigue is that it is yours, it is real, and it is how you feel. So I share with my patients that I'd like them to develop a scale about your fatigue. Let's say you choose a scale of 1 to 10. 1 is you are feeling fantastic. You're feeling so good that you can get up and you can take a shower and you can brush your hair. You could even walk down to the mailbox and you feel great. You don't have any tiredness or anything of the kind. You can go to work, you can go to school, you may even go out and hang with your friends. This is your level 1 for your fatigue for today. But let's say your fatigue is about a 10. Let's say, just like the young lady here on the couch, you are laying down and that's the best that you can do. You cannot make dinner today. You cannot take a shower today. You cannot go into work today. Your fatigue level is about a 10. The important thing is that you are able to identify what your range is for your fatigue level, whether you are a 1 or you are a 10. And with that range, you are able to educate the village, the support system around you. You'll say, hey, Arnita, I can't do it today. My fatigue level is a 10. I can't make it into work today. You'll say to your partner, your spouse, your whoever else is living with you, I can't make dinner today. I just can't. Can you take care of the kids? Can you pick them up from school? What I'm hoping that you're getting from this is that you need to identify where you are on the fatigue scale. And when you do, you alert those around you where you are so they could know what to expect from you when your fatigue level is the number that you've given it. It doesn't have to be as extreme as a 1 or a 10. It could be somewhere in between. But again, the important thing is that you are sharing with someone what your fatigue level is so that they know how to support you. Really, really key. Did you know that abnormal tiredness throughout the entire body requires a lot of effort, and there is between 80 to 90% of those living with lupus that experience some level of fatigue. So 80 to 90%, that's way more than 50%. So what is it sharing? It's sharing that you are not alone. I want to make sure that you understand that. Sometimes when you're living with a chronic disease, you could say, I am the only one that's going through this. No, you're not. You're not alone. So understand, don't hide from your fatigue, embrace it, sit with it, and share with others that that's where you are. When you have blood disorders, it can also be called anemia, where there's not enough oxygen in your blood, and that could also cause fatigue. And there's also neurological effects that can cause fatigue, like a headache or depression, or even some people may experience a stroke. GSK, Us in Lupus, has a Facebook community that we would love for you to join us. And at the end of this slide presentation, I have some QR codes that I'm going to put up. So If you can, grab a phone, grab some type of electronic device, because at the end of the presentation, I want you to be able to put your phone or your iPad up to the screen, and you will be able, that QR code that comes up, you'll be able to go right to our Us and Lupus Facebook page. But with that Facebook community has a lot of members that communicate information. This particular Facebook listener says, the fatigue, pain down to the bone, swelling and sweating every time I try to grocery shop for myself is tough. Sometimes I have to leave the groceries on the counter and quickly lay down before my legs give out. Does this sound like you? Does this sound like something that your loved one has experienced? Again, this is an example to show you that you're not alone. You have to do what you need to do to take care of yourself. If you've listened to any of the other presentations that I have communicated to you from Kaleidoscope Fighting Lupus, you know that we've talked about brain fog in detail. We know that 50 to 80% of people living with lupus may experience fog, which can show up in ways of being confused or exhibiting confusion, exhibiting memory loss, exhibiting an inability to concentrate, especially when there are a lot of external stimuli happening around you. Again, just like fatigue, brain fog is very real. Sidebar, I had a patient and her mom who were in one of my sessions and educational sessions, and when I talked about brain fog and I talked about fatigue even, they said the mother turned to the daughter and said, "So you really don't remember that I shared something with you? Or you really can be that tired even though you look perfectly healthy?" Yes, you can. And yes, it happens. So make sure that you share that information. I'm feeling this way today. And when we talk about journaling, you'll have an opportunity to see how important that plays a role. So let's move to the next phase of talking about treating your lupus, common medications and goals. Managing your lupus through treatment, symptoms will come and go with lupus. Unfortunately, lupus is not a curable disease. That roaring lion will peek its ugly head, or the gentle cub will come and soften the symptoms, but the symptoms will always be there. Lupus, though, can be managed through treatments, medication, and lifestyle changes. The treatment plan that you and your provider come to an agreement on together, and notice that I say you and your provider, and notice that I also say together. They cannot do this alone. You know how your body feels, and you are the best person to tell your healthcare provider how you are feeling. Some of the common goals for treatment are listed on the slide in front of you. I won't read them all, but just take a look at them and possibly identify, what's your goal? Is it listed? Have you shared your goal with your healthcare provider? If you have not shared your goal, I strongly encourage you to share your goal with not only your healthcare provider, but also your family. It's important that they understand what you're striving for, because they can help you reach your goal. Getting the right treatment. Before you on the slide, you'll see different classes of medications. They range everywhere from anti-malarials to anti-inflammatories. If you have lupus nephritis involvement, you may be on diuretics or ACE inhibitors or even beta blockers. And we know that oftentimes diuretics can make you go to the bathroom to urinate often, and you may not want to take them, but they are critically important to you living your best life. And so having a conversation with your healthcare provider, if you're experiencing some symptoms related to the medications you're taking, is very important that you share. There are other treatments that are not medically related, and those treatments can include things like massage therapy, counseling, or talking to someone about how you feel, especially if you are feeling your sadness gets a little bit more intense. You can also put your sadness on a scale of 1 to 10. Sadness on a scale of 1 to 10, if you say your sadness is a 10, that can sometimes be considered depression. And you want to make sure that you tell your healthcare provider and your family member that your sadness is a level 10. It can also include pain management, stress management, as well as nutritional counseling. How about taking some lifestyle changes? We'll talk about those a little bit more, but they can include things like getting enough sleep, setting the stage for your sleep, turning off electronics an hour before you want to go to sleep, as well as staying active. Does not mean you need to run a marathon, but it may mean that you could park the car a little bit further away from the store and walk a little bit further a distance to stay active. Staying active does not mean that you have to stand up and do your exercises. You can do exercises right from your chair, moving your arms up and down, raising them above your head. You can also, move your legs right from your chair. The important thing is that you are moving and staying active. Let's talk. I remember I said we talk about symptom tracking. Let's move to symptom tracking and talk about its importance. Another visitor to our Us in Lupus website says, keeping a daily journal can help you and your doctor to discover what may be triggers for some of your symptoms. Some of those symptoms can be triggered by food, some can be triggered by external environment like the weather, or some can be triggered by external environment like too many people around. The important thing is that you track your symptoms, that you have a way of writing down exactly how you feel, when you feel what you feel, and for how long have you felt what you feel. Tracking your symptoms. We talked about the importance of tracking your symptoms. Tracking your symptoms involves monitoring your disease activity. It could be monitoring any side effects that you're feeling from medications that you're on, whether they're new or you've been on them for a long time. It's talking about any changes that your doctor has made, or it talks about being proactive in a way that you can help to reduce any organ damage. That's the symptoms that's occurring on the inside of your body. Make note of your symptoms. How often is it occurring? How long is it lasting? How intense or how strong are the feelings that you are receiving from your symptoms? You could either practice talking your symptoms or writing them down. So if you have a smartphone, you can talk right into the phone, or if you're like me, I like to write everything down. Either way, the important thing is that you have a way of tracking your symptoms. Do what works for you. What works for John may not work for Susan, and what works for Susan may not work for Alicia. But the important thing is they have found a way that works, and they have made that way a habit. Health journaling. Journal your journey. Living your best lupus life is a journey. Living with a chronic disease is a journey. You will have days where you're feeling great, and you'll have days where you're not feeling great. Who else knows better than you? And how are you sharing that information? Do you have a calendar where you're able to make a smiley face for this is a great day, or an upside down smiley face where this is not such a great day? But do you have a way of tracking that? Do you have a way of writing down how often you are receiving certain tests and procedures, or how often you are taking certain medication? All of this can be a part of your journal, a part of you journaling your journey. How can it help you? Well, there are several studies that have stated that expressive writing, being able to write down how you feel, is a way of getting out that emotion. I know for me, when I am running here, there, and everywhere, I really use journaling as a cathartic way, as a way of getting out what could be bottled up inside of me. And I would encourage you to expressively write whatever it is that you're feeling. You could say, oh, that's not important. Oh, no, yeah, it is. If it's important to you, it is important to your healthcare provider as well as to your family. Writing can help you organize your thoughts. When you are involved in a lot of things, or let's say you're becoming confused by all of the different medications, writing things down can help you keep your information in a very organized and streamlined format. Over time, your journal can help you and your doctor have a more accurate picture of how you are living with your lupus, how your lupus lifestyle is affecting your body. Health journaling how-tos. Well, your journaling entry can be very short or it can be very long. The important thing is that you are journaling. You can talk about your emotional or your mental state. You can talk about, again, your symptom triggers, but make sure that you are making journaling part of your routine. Now let's move into the section about communication, staying engaged with your healthcare team. Good communication is a necessity for lupus warriors. There are so many different specialists that can be involved in your care, and so make sure that you are communicating how you feel with all of them. I've shared the term fatigue often, but you don't have to use that terminology. You can say, I am tired, and I am so tired I am at a level 10. Or I am not as tired, I am a 5 or a 1. But the important thing is making sure that you're sharing how you are feeling. Your tiredness or your fatigue can affect you both mentally, physically, emotionally, as well as socially. So make sure that you're sharing how tired you are with all of your different specialists, because that can have an effect on how they can help you to change up your medications or help you, again, to live your best lupus life, because that's one of our goals. When communicating with your doctor, there may be some challenges. There might not be enough time, or they may say vocabulary that you don't understand, and you may be, because you're afraid or you're embarrassed, you may not understand, but make sure that you do your best to write down, Doctor, you said this word. I don't quite understand what you mean. What does that word mean? You may not even spell it the way that you think it should be spelled. It's okay. Don't be so hard on yourself, but make sure that you are communicating how you are feeling, what you are feeling. And before your next appointment, take some time to prepare. The best appointment is someone that goes in prepared for their appointment. You can prepare by having your journal with you, writing down how you felt, what the symptoms were, how long they've lasted, how the intensity. You can have a list of questions that you want to ask your physician. Think about how lupus is impacting your life and make sure that that is written down. You can plan even to have an appointment buddy with you. That's someone that's going with you that has another set of ears, because there's so much that can go on inside of a doctor's appointment that you may hear half of it and then your appointment buddy can hear the other half. You can do it together. Think about your goals for treatment. We talked about those a little bit earlier. Have you shared your goals with your healthcare provider? If not, I encourage you to share them. And if you don't know what goal you want, say to your healthcare provider, I want to develop some goals. Will you help me, please? And then again, practice what you want to say. Sometimes when I'm talking, my tongue gets so tied up inside my mouth that I go blah, blah, blah. Well, I practice it. Practice it at home. You can do it in front of a mirror or not. But the important thing is that you share, that you communicate. And during the appointment, bring your journal and open your journal and say, Doctor, on this week, in this month, this is how I felt. And the doctor may ask you some additional questions like, well, what was happening the week before this week? Or what happened the week after this week? Were you thinking of some things that may have made you more anxious, or were you running around and you did a lot more physical exertion? The important thing, again, is during your appointment that you not be afraid to ask questions. Ask the questions. Even if you think, oh, that question is no. No question is a silly question. Every question that you think of to ask is an important question. Just a couple slides on telehealth. Many of you have had the opportunity to have a visit with your healthcare provider face to face. But again, many of you have had a visit with your healthcare provider where you've been sitting in front of a computer or your phone or an iPad. When you have a telehealth visit, treat it just like you treat a visit that you are having face to face. Even though you are sitting in front of a computer or an iPad or even a phone, make sure that you have your blood pressure, your weight, your health journal. Make sure that you're in a quiet place. I have a patient who says to me, Arnita, the only quiet place in my house is inside a closet. Go inside the closet, take your flashlight with you and have your visit. But the important thing is that you are prepared for your telehealth visit just as you would be prepared for your face-to-face visit. When you're using your telehealth visit, make sure that you ask follow-up questions. You're checking in with your symptoms. Make sure you're asking questions about the tests that you have. What was my test results? Do I need a consultation with another doctor for these symptoms that I'm experiencing? Are you making medication adjustments? If you are, what are those adjustments? I'm taking the medication 3 times a day right now. Are you changing it to 2? Why are you changing it to 2? Help me understand. And then always do a check-in with how you're feeling mentally as well as socially. Let your healthcare provider know how lupus is impacting your lifestyle. Another visit to the Us in Lupus Facebook page says, I recently had a telehealth visit with my rheumatologist, and she treated me like I was in her office. She sent me for blood work, looked at my hairline and hands, went over my medications and my health chart, and really, really enjoyed my appointment. Just because you're not face-to-face does not mean that anything has to change. Make sure that you really focus on what is best for you and how can you share that information. Adherence, just a little bit about what does it mean to sticking to your treatment plan. Simply put, adherence means staying on your treatment plan as you and your healthcare provider have discussed. For both prescription medications, that includes taking the right dose at the right time and the right way. That means if it's a pill, that you are swallowing the pill. If it's an injection, you are placing the injection in the appropriate space. Your treatment plan may include lifestyle changes and other recommendations, but making sure that you're sticking to it, that's what adherence is. Staying adherent can improve treatment options as well as reduce healthcare costs. Make sure you know what to expect from your treatment. Coordinating your treatment plans. There are a number of different specialists listed on this screen. You may be seeing all of them or you may not. The important thing is that you have one particular healthcare physician that is coordinating all of your care. Well, what does that mean? That means that there is one physician that can talk to the cardiologist, that can talk to the rheumatologist, that can talk to the therapist, that can talk to the nephrologist, but there's one person that's involving everyone in the loop to make sure that everyone knows your medications. When you go to the physician's office, they may say, which physician have you seen last? Make sure you share that information. You go in with the name of the physician, and it might even be helpful to have the phone number available to you. It may also be helpful to have your medications with you, just in case you forget one of them. Bring your medications with you so that the doctors can see the dosage amount as well as the prescription strength of your medication. What does it mean? I talked about adherent. What does it mean to be non-adherent? Well, that means that you were going out and you forgot to take a dose, or you decided not to take your diuretic because you didn't want to go to the bathroom too much. Or the doctor says, well, Arnita, I need you to take your doses at 8 and 2. And you've decided, I might take it at 11 and 8. That means you've extended the time between doses. Or you've decided, I don't like this medication anymore and I'm just not going to take it. These are all what's considered to be non-adherent. It's important that you understand how your medication works and the reason that your physician is asking you to take it at those certain prescribed times. Actively engage your physician in your treatment plan so that you understand, well, this particular medication makes me do this. I can't take the medication at 2 o'clock because at 3 o'clock I need to pick up my kids, and that's when I start going to the bathroom a lot. Talk to your doctor. Again, having that communication is so very important for helping you to live your best lupus life. Remember in the beginning, I said that I had QR codes. Well, now is that time to bring out that phone, to bring out the pad, or even to hold your computer up to the screen. Before you are 4 QR codes. When you hold your device up to the screen, it will take you right to our Us and Lupus Facebook page. And you can look at symptom tracking, more information about that. You can look at possibly signing up for receiving a symptom tracking kit. You can learn about keeping your disease activity low, as well as understand the financial impact of living with lupus. I want to thank you for taking the time to gain knowledge, to be more powerful about your lupus, to understand the importance of communication, of tracking your lupus symptoms, to understand the importance of having a range, of sharing how you're feeling with your tiredness, with your fatigue. What scale are you on? Did you make journaling your journey part of your daily habit? Have you shared with someone that your fatigue is impacting your social life, your physical life? It's impacting you at work. Have you communicated that information? Have you communicated that your goal is to be less fatigued certain times of the month? Have you shared that information? If you haven't, I strongly encourage you, take the time to write down how you're feeling and how lupus is impacting your life. Again, I want to thank Kaleidoscope Fighting Lupus for this opportunity. I so have enjoyed my time with you, and I really do hope that you've been able to take at least one item out of this presentation that you are now going to incorporate how to live your best lupus life. Thank you again from GSK, from Us and Lupus, and from Arnita Roberts-Christie.
Thank you, Arnita. This brings us to the end of our symposium, Lupus Fatigue, Causes, Treatment, and Managing Expectations. We hope you found the discussion and resources helpful. Once again, a special thanks to our presenters, Dr. Sharon Dowell and Arnita Roberts-Christie. And thanks to our presenting sponsors, GSK, and to Kaleidoscope Fighting Lupus, for both of their continued support of those living with lupus and lupus fatigue. And finally, we want to thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, award-winning blog articles, and much, much more. Thank you for spending time with us. I'm Dr. Lindsay Springer for Kaleidoscope Fighting Lupus. Please take care. you.